Let's completely change the subject now. We've talked about the sources of medications. Now let's talk about how we name these medications. And in the example behind me are numerous examples of what's called chemical names. Chemical names are assigned to every drug by the International Union of Pure and Applied Chemistry. This is the IUPAC. And what it does is it describes the molecular structure of that chemical, and it distinguishes it from all the other chemicals. It is commonly used by drug companies and by drug researchers, but as you can see, these are way too lengthy for everyday use, even within a hospital setting. It would be really, really awkward for me to ask a physician for 2R, 3S, 4R, 5R, 8R, 10R, 11R, 12S, 13S, 14R-13, subspecies 2, 6, di. Okay, you can get my point. Remember that these are designed to describe the chemical layout. What's more common in healthcare is to use the generic name. These in the United States are governed by the United States Adopted Names, or the USAN Council. There is only one generic name for each chemical name. It may consist of two words, but the first word must be recognized by all of the healthcare providers. An example of generic names include diltiazem for the chemical diltiazem hydrochloride, zolpidem for the chemical zolpidem tartrate, and phenytoin for phenytoin sodium. And you can see that there's part of their generic name comes from their chemical components. And in the slide behind me, it does talk a little bit about some of the stems which are used for generic names and how they can be applied to the different medications. Then there is the trade name. Trade names are created by the drug company itself after final approval by the Food and Drug Administration that their chemical is safe and effective for treating diseases or conditions in the human body. And they give it a brand name or a proprietary name, which shows ownership. The drug packaging and advertisement often show a trademark, a symbol, or a registered trademark symbol. There will be a marketing strategy to promote advertisements in media, such as online, on the television, and in magazines. They are designed, these trade names, to make it easier for the patient to remember what their name is. And because of that, they may be a little bit creative in how they put their words together. They may suggest how the drug is used as well.